I'm Carolyn Sheridan, Clinical Director for the AgriSafe Network. I'm going to talk to you today about respirator fit testing. It's very important when you select a respirator to make sure you also have a good fit. So with the help of Aaron here, I'm going to show you how to put this respirator on correctly. What we need to look at is that it's got 5 contact points on the back. 1, 2, 3, 4, and 5. We want to make sure that we utilize those 5 contact points as well as possible. So I'm going to ask Aaron to put the respirator in his hand, such as this, with the 2 straps draping over the back of his hand. He's going to then put that in, cup it over his chin, put the top strap on first, up over his head, second strap on, which will go around the base of his neck, and then he's going to use 2 fingers like this and press in on that 5th contact point. He can then cover the mask completely with both hands and blow out. If he feels any movement of air around the nose or the chin, he can then readjust the straps on the sides or press down again on the nose. The other good thing about this respirator is it's got exhalation valves, so if Aaron were to wear glasses, he then would not fog up his glasses. This is an excellent respirator choice for Aaron. This is a canister air purifying respirator, and we need to make sure it's the right mask for Aaron. So I'm going to ask Aaron to put the mask on, and I'll give you some short, simple tips on how to make sure the mask fits. Aaron puts the mask on by putting the cradle on the top of his head, and then we attach the back straps next. In order to make sure it's seated well on his face, I'm going to ask Aaron to cover the outsides of the canister and suck in. That causes collapse kind of around the nose, so we know there's pressure inside. And then you're going to cover the exhalation valve on the bottom, blow out gently. If there's any movement of air around the nose or the chin, then I would then tighten the straps, such as this. We have straps on the bottom as well that we can tighten. So if Aaron's able to do those 2 processes of covering the exhalation valve and the inhalation valves and not have any air leakage, then we know it's a good fit for him. This is a paper mask, which is considered a filtering face piece. So with the help of Aaron, I'm going to show you how to make sure that mask is right for you. So if Aaron would take this, put it in his hand with the straps draping underneath, he's going to then put it up to his chin, putting the top strap on first, the bottom strap on next. And because this mask has 5 contact points, 1, 2, 3, 4, and 5, we want to make sure we make the best use of those. So Aaron's going to take 2 fingers and press down on either side of the nose piece. Then he can cover that respirator with both hands and blow out. And if there's any leakage from around the nose or any place on his face or his chin, he can then adjust the mask or adjust the straps to make sure it's a good fit for him.